Well, hey, everybody, and I have a guest today, and you're not going to believe this happened. I'm sure this has never happened to anyone else, but there was an incident. So, Michelle, I'm just curious. Tell us a little bit about yourself.
Yeah, hi everybody. I'm Michelle. I'm an investigative reporter for
Oh, an
Hunterbrook.
investigative reporter. Oh, we're investigating something already. This looks interesting. So, Michelle, investigating for?
So I'm investigative reporter for Hunterbrook Media. We look at undercovered, under scrutinized topics. One of our focuses is the healthcare industry. There's obviously a lot to look at there. And we've recently been looking into the nursing home industry specifically.
Oops. All right, so nursing homes, that's like skilled facilities, it's residential facilities, all nursing home only or beyond nursing home, assisted living, boarding
So
care, what do you
Yeah,
look
it's a
at?
good question. We specifically have been looking at nursing homes funded by CMS. So these
Ah,
are, yeah, a lot of them tend to be skilled nursing facilities, also called
okay.
SNFs. So that's
Yeah.
been the focus of our investigation.
Okay. All right, and so you were looking at these facilities because there had been some issues that were raised, I'm assuming.
Yeah. Yeah. So I actually got a call from a friend of mine who's an elder abuse lawyer maybe 6, 7 months ago, and she felt overwhelmed. She was like, we just don't have all of the resources to be able to deal with everything that we're seeing happening in these nursing homes. I started to look at it. I spoke with lawyers, public advocates, caregivers, doctors, nurses, etc., and kept coming back to these major public companies that operate hundreds of nursing homes. We actually ended up specifically looking at the Ensign Group, who operates more than 300 nursing facilities across the country. And yeah, we started with the people. We wanted to understand what was actually going on for the people that are living in these
The
homes.
residents, people
The
that we call
residents,
residents, people who are receiving supporting of supportive care, people who
right?
move into this situation because of physical health issues, cognitive health issues, a combination of those kind of things that
Mhm.
got them to a place where they can't be back out on their own.
Exactly. And these places, especially the skilled nursing facilities, they're meant to rehabilitate. They're meant to
Okay.
take care of people who are vulnerable, who need help. And just to give you a couple examples of what we've come across, last year we looked at a report from a nursing home in Texas, operated by the Ensign Group, where a nonverbal resident with Alzheimer's was found not by the staff, but by her family, covered in ants, bites all over her body, swollen shut eyes. Again, discovered by her family, not the staff.
Hmm.
Um, yeah, so
Had she been a resident for long, or was it a new admission that had just come in?
she'd been a resident for a long time there.
Oh.
We found several other cases of neglect at this specific facility. Um, For other examples, we had people reach out to us after we published our initial investigation, and what we heard was a lot about hunger actually in these nursing facilities. People were not fed appropriately, just a lack of resources. We also learned that specifically patients with dementia or Alzheimer's who could not feed themselves were often left unfed because there just
Mhm.
simply weren't enough staff to help take
Okay.
care of them. So this is something that we've learned, unfortunately, from talking to
Yeah.
caregivers.
So not having enough staff, but I would also advocate for not having trained staff because if
Right.
you're not sure how to support someone, you could offer one bite, and if the person doesn't understand what you're doing in that moment, it would be really easy for me to pull my face back, like, what is going on here? And for you to assume that means I'm not hungry versus I didn't understand what you were trying to do. And
Exactly.
in these cases, what the result is, the outcome is somebody doesn't get food.
Exactly. And that's a really important point about the training because what we found when this big public company takes over a nursing facility, all these resources get drained and they start hiring fewer RNs and more highly skilled, highly trained people in place of typically CNAs or people who can get, certification within 3 to 6 weeks or something like that, as
Yeah.
opposed to people it takes a lot
Who
longer for them.
actually have some expertise and have developed that expertise and have some credentialing. Although we know across the US, there is absolutely no requirement to have any skill demonstrated in dementia. At least if you have some credentialing, that would be better than no credentialing. So personal care
Right.
people versus, so how bad was the problem when y'all did this investigation? What did you find out? How extensive was the problem?
So I'm a sociologist by training, so I really
Mm,
try to look at systems, and we found a systemic, massive problem across the country. We specifically looked at understaffing. And so what we did was we took a formula from this 2025 study by UCSF researchers who translated basically how sick a resident is into a
yeah.
number of hours that they need, how much care that they need. What we found
How many
was,
minutes? Let's be honest. How many
right,
minutes are needed?
exactly.
Yes.
Right. We found more than 5 million missing hours. This is just a 5 month period we were looking at, by the way, just because of data availability. Over 5 million missing hours of care for, again, residents that needed it the most. And then from there, we translated into a dollar amount. Like, how much money are these companies profiting by failing to
Mhm.
provide the care that residents actually need? And
Mm.
again, this 5 month period, it was like 160 million plus dollars of profit from not providing care that residents need. And we found this across the board. This was again a systemic issue.
Yeah, and the really concerning thing is the legislation that looked toward upping staffing actually got kaposh, like not we're not doing that after all. And so we don't have the outcome of more staff coming,
Right.
um,
And
and trained
rescinded
staff.
exactly. And rescinded intentionally, by the way. We found the Ensign Group was involved in getting this
Oh,
legislation that had there was supposed to be a minimum staffing level of
yeah.
federal legislation that ended up getting rescinded after some lobbying.
Very
So
short, very short window of time. Yes, once the some things changed. So with the outcome that you came up with, which is, wow, we got a huge problem, Houston. We've got this in plain sight. This is happening pretty routinely, pretty regularly. We have folks not receiving care that should be receiving care. Where do you want to, where is it going? Where do you feel like this might go next from the investigation that you've done so far? What's next? What happens?
yeah, well, we really want to help families, residents themselves make informed decisions.
Mhm.
And one of those things is helping people understand like what's the quality of this nursing facility versus the quality of some other nursing facility. And
Yeah.
one of the things that we looked into was how this system can be kind of gamed. So there's a CMS website where everyone can go and
Mhm.
see, okay, this many overall stars, right? And then this many
Right.
stars, blah, blah, blah,
Five
blah.
stars, 3 stars, four.
Yeah, we found the system's pretty gamed. So if
Mhm.
you're looking at something like quality metrics, vastly that's self-reported data, right? Overall
Ah.
ratings informed by self-reported data. So what we
Mm.
really want people to know is how to actually look at these metrics when you're trying to decide where to send your loved one. And so we're trying to get it out there that when you're looking at the CMS website, really pay attention to what you're looking at. Health
Mm.
inspections and staffing tend to be more auditable or externally conducted metrics, whereas quality measures tend to be more self-reported metrics. So really paying attention and doing a bit
Mm.
more research rather than taking these star ratings at face value, I think is what we're,
Okay, so wishing upon a star is not a good option here. We really
yeah.
do want to dig down into the numbers and look at how many staff are supposed to be on duty and how many showed up. Like, is it actual staffing numbers or proposed staffing numbers? Is it how much, like whether or not the skill of the folks, whether we have people on board or we don't have people on board? We're missing people. We have empty slots. How many and how much is it possible to look at turnover?
Yeah, you can look at turnover. I would say it's not readily available. You have to
Mm,
really dig into the CMS website to find it. And another thing that we found is a lot of these metrics again can be manipulated,
mm,
inflated, etc. So it's tough to kind of
yeah,
discern. But what I would say is it requires a lot of intensive research to really know what's going on.
yeah. So this gets messy because families often feel like I can't do this anymore. They're not getting reimbursed anything for doing this care at home. And the
Mhm.
only place that some reimbursement can take place is in a facility, unless you have long-term care insurances or unless you meet this criteria or unless you get in a PACE program. Those kind of programs will allow you some options, but many folks are in a corner because what they either can do is institutional care or home care. And if they do home care, they have to meet certain criteria or they don't meet those criteria, and then families just have to provide, or friends and family provide, or the person can pay for it themselves.
Mhm.
Um, so we have a huge issue here where the marketplace is sort of hiding some things with some stars
Yeah.
that make people feel more confident and comfortable. And then, unfortunately, I imagine families that experience these awful events are
Mhm.
outraged and are thinking, well, there's got to be a way to make this work better. But what was your finding there, if anything, when families said, well, this is outrageous, this shouldn't be happening?
Yeah, I mean, in terms of like what can be done about this, well, one thing is what they what tried to get passed before was this federal legislation. Like we need to have some sort of minimum
Yeah.
level of care that is offered to people that need it the most. A more transparent system, like these star ratings and metrics, it should be readily available. Like, hey, this is self-reported data. This is, more objective data that you
Mhm.
can look at
Mhm.
and trust. And yeah, just more trained staff available in these facilities. Another thing we found is like the money is there, it's available. CMS is reimbursing hundreds of millions, if not billions of dollars a year to these facilities. And so taking a real look at where that money goes, how it can get funneled through
Yeah.
these nursing facilities to related parties is a really big part of our investigation. So the money exists, it's about how it gets distributed. And really taking I think regulation and would be a really important step here.
So for those of you out here who are listening and going, wow, what? We're going to give the link for the piece that they did because it's super important to go look at the data because that's what we're advocating for. Look at real data and see what's happening. And then decide what's my next step. And it could be advocacy, it could be self-advocacy, advocacy for others, it could be raising an alarm, it could be sounding a call. But what we want to do is go, wait a minute, this isn't what it should be for the price tag. Price tag is high. The question is, what are we getting for that price tag? And being more discerning, but also being more curious is what we advocate for. Michelle, anything you want to add in closing?
Well, we're going to keep reporting on this. It's really important to us. We find that like not a lot of news or coverage of these undercovered topics. And so if you have anything that you'd like to share with us, whether that's stories of your own or you think like, oh, this is a really important topic that we want someone to look into, we're investigative reporters, so you can reach out to us and we'll give you our contact information here.
Absolutely. All right, everybody. So, not the best news in the world, but important information. If you or someone you know might be contemplating the need for a skilled facility for care, particularly for people who are having some brain changes in addition to whatever else might be going on for them that qualifies them for that care, because it turns out not everything that is said is delivered. So, till next time, take care of yourselves, take care with your care, and we'll talk again soon. Thanks, Michelle.
Thank you so much for having me.
Bye, all.